Good morning. I'm Dr. Shamik Ghosh, one of the senior consultant pediatricians with the Bhagirathi Neotia Women and Child Care Hospital here. Medicine is facing probably its greatest challenge in the last century in the form of COVID-19. We as pediatricians are relishing the challenge to some extent, and yet we need to be on our guard and make sure that as many people as possible stay safe and stay healthy. Today we shall be talking about how it is impacting the pediatric population, and I shall divide my talk into some specific target messages. The first part of the talk shall be on what are the symptoms of COVID, if at all it affects children. What are you going to be doing supposing one of your family members is detected to be COVID positive? And thirdly, a very integral part of pediatric practice and public health importance is vaccinations. So how does the COVID situation impact the vaccination strategy? So coming to the first part, first and foremost, the clear message that should go across is children, from whatever evidence is available till now, have been less affected by the COVID virus as compared to the elderly and the immunocompromised. Why this has happened is a matter of still conjecture, and let us not delve into it. But at the same time, the message should be very loud and clear that we should not let our guard down when it comes to protecting children. Standard measures that need to be maintained for everyone, including social distancing, including hand hygiene, proper cough etiquette, and the use of masks in more than 2-year-olds have to be followed even with the pediatric population. Standard symptoms of fever, cough, especially with loss of taste, loss of smell, and respiratory distress would definitely be warning signs for us to clinically suspect COVID even in a pediatric patient and ask for the requisite testing. Other than that, in the pediatric patients, because respiratory secretions tend to be swallowed, there could be fever with vomiting, and because it enters the intestinal tract, there could also be loose motions as part of the COVID presentation. The virus is also known to enter not only through the respiratory tract but also through the gastrointestinal tract per se. Hence, diarrhea as a presenting symptom along with fever can be a presentation in the pediatric population. The other group which we would be aware of is asymptomatic COVID patients. Now, these asymptomatic COVID patients in the pediatric population, they would be the ones who possibly nothing has yet been identified or nothing has yet been said about how virulent they are, but there is a possibility that they could be spreaders to the vulnerable adult population. But really, unless and until somebody in the vicinity is COVID positive, it's very difficult to identify this asymptomatic group. So, having told you about the symptoms in a child which should warn you about seeking medical attention, we next go to the step of what is to be done if supposing somebody in your family is detected to be COVID positive for any reason. So the first thing is, more than 80% of cases of COVID are going to be mildly symptomatic or asymptomatic, and they are going to respond to standard measures like paracetamol, enough fluids, multivitamin supplements, and a good nutritious diet. There will be 15% of the patients who will develop cough or a small amount of breathing difficulty and might need hospitalization. And there will be 5% of the patients who might turn critical and require intensive care. The pediatric patients till date have largely fallen into this 80% category. A very, very small percentage, insignificant enough to be quantified, have fallen into the category which might need hospitalization. Thankfully, almost negligible reports have come in of the pediatric population falling into the category of people who become critically ill. So if you get a COVID positive in the family, the first thing is the affected index case has to be quarantined within the home, and it has to be left to the discretion of the physician who is treating the patient to decide whether this particular index case requires home treatment or needs to be hospitalized. The other members follow the standard safety precautions, and as per the latest ICMR guidelines of 18th of May 2020, between the 5th day of exposure till the 14th day of exposure, at any point of time for contact tracing, these asymptomatic immediate contacts, they need to be tested so that they can further be isolated if they turn positive. The third part of our talk today is about vaccinations. Now, when the lockdown was initially imposed to prevent overcrowding, to prevent gatherings at public health clinics, vaccinations were withheld for about a 4-week period. But gradually, all the apex bodies, including the Center for Diseases Control, the World Health Organization, the Indian Council of Medical Research, and almost all the physicians of this country realized that if the vaccinations were kept postponed, there would be breakthrough illnesses of the very vaccines against which they protect, like measles, like polio, and any of the other illnesses that we seek to protect with vaccinations. Hence, as soon as the 4-week period, which is a standard period for which a vaccine can be delayed, was ended, the World Health Organization, the Indian Academy of Pediatrics, as well as the government health centers, they resumed vaccinations. Vaccination services, in view of the renewed lockdown in the containment zones, would once again get affected. People may require permissions from the authorities, or people may be physically prevented from reaching the healthcare clinics. In such situations, please get in touch with your individual pediatricians who shall be able to guide you as to when to take the vaccinations at the earliest. The basic principle which we shall be going by is, as soon as you are accessible to healthcare, you should try and take your vaccinations on time. If there are restrictions because you are within the containment zone, there might be a delay of a week or a couple of weeks, maximum 4 weeks, but under no circumstances should you keep the vaccinations postponed indefinitely. Here at the Bhagirathi Neotia Women and Child Care Center in Rajarhat, we have ensured safe practices both for outpatient patients as well as for inpatient patients, so that the chances of transmission at a healthcare provider institution are absolutely minimized. It starts with a thermal scanning at the entrance, segregation of the patients into safe distances in the waiting area, a separate fever clinic, separate well baby clinics, and doctors, nurses, management personnel, everybody follows the strictest protocols so that you are safe and we can keep you healthy. Thank you so much.